Live from New York, the PIX 11 Morning News.
Listen in this, because it's Procedure Friday. Ooh. And here on the PIX 11 Morning News, we do things big. So big that we're going to help you burn the fat. But we're not going to burn the fat in the traditional way. No, we're going to do it.
We're not using the thing where you're doing that.
No. We're going to do it with the help of music, sound waves.
Really? Yes. We're going to melt that muffin top away.
I like that.
Live on there. Let's go over to Dr. Steve.
Oh, you guys just wish it was that easy. Well, we're showing off another fat-reducing procedure today. This one's called Liposonix, and it reduces fat with ultrasound energy. And joining me now is board-certified dermatologist Dr. Rokhsar, and he's going to demonstrate how it works. And we also have a patient, a very brave patient, Christine Kinney. She's here as well. Christine, good to see you. Nice Dr. Rokhsar, good to see you.
Good morning. How are you?
It's great. So let's talk about Liposonix. How does it work? I mean, you know, we're joking, says music, but it's ultrasound, right?
Yeah, it's all, you know, Liposonix, the energies, we've had it for many years. It's ultrasound. We use it in OBGYN, you know, to look at babies. But the way this is different is that this energy, this ultrasound is focused. It's focused at about ½ an inch deep. And it's also high intensity. So it basically hits the fat layer at about 1.3 centimeters deep, and it injures the fat cells. And then what happens is that the body's scavenging cells, those are called macrophages, they come in and they kind of scrape up the injured fat cells and they take them away. And that's how the whole, you know, the whole concept.
Now the procedure takes about how long? We're going to do the abdomen.
You know, this will take about 45 minutes to an hour to do.
Right. And who's the ideal candidate for somebody like this?
The ideal candidate is somebody who's got diet-resistant, you know, and exercise-resistant fat. Somebody who's in shape and is not obese, but they've got pockets here and there, and you know they want to just, you know, improve that. So, you know, Christine here is an ideal candidate.
But you have to have an inch of fat at least, right, to do this. You don't want to be too thin for this because it can be very painful.
Yes, you do have to have fat. You know, we have to be able to pinch the fat because we need at least a cushion of 1.3 centimeters to be able to, you know, when that's ½ an inch to be able to, you know, hit the fat.
Let's talk about two things about the procedure. There's some pain with the procedure because a lot of people think ultrasound, oh, it doesn't hurt at all, but this is a different story, right?
That's right. See, diagnostic ultrasound does not hurt because it's not focused and it's not high intensity. This is focused, so it does have a little bit of pain. The pain is very manageable and tolerable. So,
okay, we're gonna get started. We'll demonstrate how it works. Again, this is on a lower intensity because she hasn't been medicated. And also, talk to me about the bruising that we have with this.
Basically, patients get bruising, and the bruising usually happens, you know, about 48 hours to 72 hours later. And you know that's indicative of something's happening there. You know, the fat cells are getting injured. A little bit of bleeding happens underneath the skin. That bruising usually resolves within a few days.
Okay, now why?
And there's usually no post-op pain.
Okay, Christine, why did you decide to do this? Do you think that you want to, you know?
Yeah, I just want to tone up. I mean, I eat healthy and I work out on a regular basis, but
this is like a trouble spot
for
you, right? Okay, so put it on, Doc. Let's get it just an idea of what it is so people can understand. And again, this is at a lower setting. And while you're doing that, we're going to throw some before and afters up on the screen so we can see the results. People at home, here you go. These are pretty typical. How long does it take before people see the results from this procedure?
You know, you have to wait. You know, they start seeing results about 1 month. You have to wait a full 3 months. That's how long it takes for the fat cells to slowly get resorbed by the body. Now, at 3 months, you can consider if you want to have a second procedure done.
Okay, so put it on just so folks can get an idea. And this would take about an hour or so to do the whole abdomen, right? So you can expect to spend some time.
So then that's basically it. Here's the transducer is in contact with the skin. You know, each area, each one of these squares gets treated for about ½ a minute to a minute. And we basically go over the area, you know, we do a bunch of passes here.
So is it breaking the fat?
Yeah, the ultrasound actually destroys the fat cells, and then it gets absorbed by the body, and you know, after a while, it's gone.
It injures the fat cells, and those fat cells basically kind of slowly go away.
Beats up the fat cells. That's what it's doing, that ultrasound. It's taking
makes everybody happy to get rid of the fat cells. All right, so we're going to do this this morning. Obviously, this is a long procedure, but we're going to come back in the next hour with another patient. You can actually see the results. This person, that patient had the treatment, is already done. We're going to meet that person, had the procedure to melt away love handles. Guys, we'll see you.
All right, so he said you need about an inch of fat. What if you have, like, you know,
I have
like
a few.
little, yeah.
You know.
What if you have a bag of fat? Hold on, let me get it. Hold on, Doc, we're coming. All right, thank you. We'll check in with her a little later on. All right, and we'll keep walking this way.
Yes,
do you want to do it again? Yes, we have another segment.
We have another segment. We'll
because this is our patient right here. Hey, Christine, how you doing?
Good, how are you?
Okay, so this is called Liposonix, and we've been doing it for like what, the last hour?
Well, 20 minutes or
Okay.
so. But the thing about it, we want to let everybody understand that it's set at a very low setting. So in the real world, when this is done, it's more painful, but you get medication to help with the pain, just so you know. But for demonstration purposes, you don't want to medicate her and stuff.
All right.
So this is Dr. Rokhsar, and he does this procedure in his office, and Christine over here. So talk again about the ideal candidate for this procedure.
Yeah, the ideal candidate is somebody who's got pouches, got a little belly, a little, love handles.
Okay.
This also can be treated on the thighs, inner thighs, outer thighs, even arms, people with heavy arms. But, it's not for somebody who's obese. So, this is not a replacement for diet and exercise.
Right.
Yeah, that's what we need to know
But what's
about.
the line, though? I mean, how overweight can you be and still get this? What's the line?
Because we want to know.
I want to know.
Because the two of us are a little chubby here, and we'd like to know what we need to do.
I don't know.
Look, if we can pinch your fat,
I'm pinching.
we can treat you.
Okay.
As long as one has realistic expectations that you don't do this and all of a sudden, you're going to lose 50 pounds.
Okay.
Yeah, it's not going to happen.
Right. Yeah.
Well, we have a patient over here who actually did it.
This
so.
is Mark Harris. He had his
Mark.
love handles done. So, Mark, how was it? Tell him how it was.
It was a simple procedure for me, and it worked.
Can I ask you a question?
Yeah.
Can you take your shirt off for me? Please, with sugar on top. Okay.
Man, there you go.
Nice. Look at you.
So I had my flanks done and my belly, and I had extra throughout here. So I'm really happy with the results.
Yeah, we actually have before and afters of him. There you go.
There you
Here's
are.
his before, and there is after. See, again, though, he's not really obese. Okay, that's the point. Is that, and you can expect about like a 20% improvement.
You
really.
look hot.
Yeah.
Can I tell you that? Do you feel confident?
I do, and it actually gave me more confidence to
Take
do
your
more.
Because you know what? When a
off.
woman asks you to take your shirt off live on TV and you did it like that, I love that.
And she does that a lot.
Well, and thank you. Thanks for that opportunity.
It looks good.
Let's talk about the cost of this for people. Yeah, people want to know.
For an abdomen, a typical abdomen, the cost will start at something like $1,500.
Okay.
So fairly affordable, when you compare it to liposuction.
Right.
Okay,
How much is liposuction?
Yeah.
Well, it depends. Okay. Liposuction still, remains the gold standard. This is not, liposuction. The results are not as good as liposuction, but on average, on a liposuction on abdomen will cost on the order of $6,000.
Okay, so would she be a liposuction candidate?
She can if she wants to.
Okay.
She can if she wants to. Again, that's a patient decision.
Yeah, because a lot of people don't want to go through the pain because it looks painful, liposuction, and this looks a lot easier.
Liposuction has also come a long way since the beginnings. We do liposuction under local anesthesia now. We don't even put people to sleep.
Oh, I didn't know
It's
that.
called tumescent liposuction. So it's really a quick in and out type of procedure also.
Wow, that's kind of
And
interesting,
they
too.
have ones where they can tighten the skin as well, so it does
We can
more.
use
It's really
lasers
advanced,
basically, to combine it with liposuction. So liposuction is also not what it used to be 20 years ago. There's a lot of advancements made in that as well.
Well, I just like that. Look at Mark's after. I mean,
That's
okay, lift up your
right.
shirt again, Mark, really quickly. See, look at that. See?
That looks good. I mean,
That looks good. When you have,
can you make me look? Can you make my stomach look like
go.
it?
Are you gonna, because men get a little robust here, like women do, like in the middle, when you get to a certain age, and it's hard to get rid of that stuff.
Yeah, it could be a trouble spot.
For men, especially love handles, a lot of guys don't like their love handles. Women don't like their saddlebags, their thighs,
and
men
tops.
muffin tops, and
And our
men.
this.
Yeah.
And our butts.
Men love handles.
I could go on and on. I try to not look at myself naked after a while. I just dress in the dark. I blindfold my husband. We just do it that way.
Oh my gosh.
But I understand. But are you feeling okay?
Yeah, great.
And it didn't hurt you at all?
It feels like hot pinpricks.
Hot pin, like on a level of 1 to 10, what's the hurt factor?
It was like a 3 or 4.
Yeah, but remember, this is at a
This is a
low
lower
setting.
setting.
Normally, you do
How
need
much did
pain
it hurt when you
medication.
did it? Like how bad was it?
Most of it, I did 22 different points. Like Christine has some points there, and I did 22 different ones, and for 18 of them, it was no problem. The few around my belly button, around an 8.
The sensitive
Ooh,
stuff.
Yeah, about an
okay.
8.
But looking at his before and after, I mean, you see the result, and
Yeah.
I think it's worth it if you get that sense of confidence where you want to take off your shirt and you feel you get your sexy back. That's priceless.
But it's all about proper pain management, and we were talking about that on the break. If you give the patients the proper amount of pain medication, they should tolerate the procedure fairly well.
The FDA has approved this device that that we can actually claim that based on the studies that after one procedure in the abdomen and the waist, you can lose about an inch. That's one size.
Wow.
So that's what the studies have shown, in patients.
Dr. Rokhsar, thank you so much. And I think they'll call you Dr. Rockstar after that. You know what I mean? For giving them their body back. But you are a rock star.
That was good
For
stuff.
more information on Liposonix, you know what to do. Meet us on the web.
Yes.